in Ohio to be residential care facility, RCF, under the Ohio Department of Health that cares for 3 or more, but less than 16 unrelated individuals. Ohio Department of Health residential care facility providers must also provide skilled nursing services to at least one of those individuals, in addition to supervision and personal care. Among the requirements is that the building must have an occupancy that's group residential, group code 4 or I institutional 1 or institutional 2. I have been working with a client in here for a while now, for a couple of months, and we have been trying to license residential care facility, but one of the things that they give us hard time for was the fact that our occupancy certificate did not include the correct group type. Okay, so we needed, according to them, we needed to have a residential group R4 in this case, because we only have 4-bedroom house. But most importantly, we also needed to have a house that's fully sprinkled, okay, and have a fire alarm that sends an alarm signal to the fire department or a monitoring company. So we need to have an automatic fire extinguisher, which is in this case the sprinkled, and then we need to make sure that our fire alarm system in the house is directly connected to the fire department. This is for residential care facility that's licensed by the Ohio Department of Health. Be mindful, we had the fire department. They gave us a green light. We did the inspection for the heating and cooling. We did the inspection for the occupancy, all of those things, right? But the question comes back to, you can get a nurse that can provide skilled nursing services to one of your clients by just hiring them or contracting them, or contracting with a home health agency that can provide skilled nursing to your residential care facility. So that's not really the biggest issue for this client. The biggest issue is the house is not theirs. They don't own their home, and they don't have really a long-term contract. The cost of fully sprinkling your house and installing an automatic fire alarm system that's connected to the department of the fire department is a huge undertaking in cost. So if you're just renting a house for 3 years, let's say 3 to 5 years, which is not really a lot if you think about it, because the initial cost of this business is heavy. Do you think it's worth installing sprinkler system that could cost you up to $15,000, setting up an alarm for a house that's not yours? Is it worth it? That's the question that the next person who wants to open a residential care facility group home in Ohio need to ask themselves. So yes, you will need a sprinkled house, we found out, definitely, for specifically this group home of residential care facility. There are Ohio Department of Developmental Disability and other programs I'm reading about that will let you get away with it. But the residential care facility license that we were trying to get, because I think it pays more money, is difficult in that they want the house sprinkled. Everything else is fine. I mean, everything else It's really the same as everyone else. Your house will be inspected. You need to get a house. You need to fully furnish the house. You need to meet all these other requirements. You need to get a certificate of occupancy, which we got. But what about sprinkled? That's the question. The biggest undertaking for this client will be to sprinkle your house or not to sprinkle the house. Not to sprinkle the house means no license. Sprinkle the house means what kind of agreement, lease agreement do you need from the landlord? How long do you need to recoup your money? That is the question. And those of you guys who have done this before, how much did it cost you to sprinkle the house? I called several companies and they're all saying, we can come out to do a survey and give you this and give you that. How much does it cost to sprinkle the house? I don't know. I have not done one before. But that's what the requirements are. You need to get a house. you need to get a certificate of occupancy for a residential group. 4, even 3 is fine. You need to get a fire department to come out and inspect the house. You need to inspect and you need to get someone to come out and actually give you a passing grade for your HVAC systems. And that's what I'm finding out, that it wasn't easy. It's not easy, but all of this was done except the sprinkle. We didn't think it was a good investment to sprinkle the house, so we're moving towards another program